Good evening, friends. I'm with you again with a common problem found in females, that is urine infection. Urine infection, what to know and how to be careful about it. So, I'll start with urinary infection. What is urinary infection? Urinary infection is the infection that is by the bacteria of the urinary tract, that is urine tube, bladder, or higher up, kidney and the ureter, that is the higher tubes which are connecting from kidney to the bladder. Urine infection, why is it so common in females? Because the tube which is connecting from the urinary bladder to the outside is very small. It is very short. It is only about 4 centimeters. So, because any kind of bacteria is able to ascend up and reach the bladder and cause infection, hence it is more commonly found in females, ladies. Now, what causes urinary tract infection? So the causes are, there is number one, the proximity of the urinary urethra, that is the opening of the tube, to the anal region, that is the place from where your motion is coming. And because our motion contains a bacteria called E. coli, so sometimes that E. coli can traverse from that area to the urinary tube, and it can reach the bladder or higher up if the hygienic conditions are not maintained properly. Secondly, because the urethra is short, as I told you, the tube is short from bladder to the outside, hence the infection is common. If the hygiene is not properly maintained, then that is one of the reasons. And if the patient is diabetic, then that is again one of the reasons of patient being prone for infection. Sometimes in cases of stones, if there are stones and if there are blocking some part of your urinary hole tract, then in that case also, because of the retention of urine, the urine infection can occur. Fifth reason could be if you are holding the urine for a longer time because of some reason you are not able to go, and the urine stays in the urinary bag, that is bladder, for longer time, then also the proneness for infection is there. Now, what are the symptoms? When do you realize that you have urinary infection? If there is burning when you pass urine, there is burning. You have got an urge to pass urine, but when you go to pass urine, you're not able to pass. That is, urge is there, urgency is there, and secondly, you have to go very frequently to pass urine. You have just come out of the toilet and again you feel like going again. So that is, these are the typical symptoms. Sometimes if it is associated with some stone, then there could be pain in the back or pain in the abdomen also. Then what care should be taken regarding treatment? Actually, when you reach the doctor with these complaints, the doctor gives you some medicines, some syrup to drink and some tablets. Actually, when the doctor gives the treatment, you take those tablets for 2-3 days, you take the syrup and you feel comfortable, your symptoms are gone. So you feel that now the infection is treated, you need not take any medicine further. But that is where the fault lies. If you don't treat the infection properly, completely, then it recurs, and then that is what we call as recurrent urinary tract infection. And then once it recurs, then the antibiotics, the bacteria become resistant to those antibiotics, so antibiotics don't work, and then it becomes a very chronic condition where you repeatedly have urine infection. Now, what should be the way to prevent urinary infection? So there is one, you have to maintain hygiene. You have to clean that area once you pass urine, always as far as possible. Then you are supposed to avoid using public toilets without maintaining cleanliness. That now these days we get those toilet seat sprays. You can spray that and then use it. Or preferably, if you have got a choice of using an Indian toilet, and if you are able to do it, you use an Indian toilet for passing urine. And the third thing which I suggest sometimes is that you don't, when you are not able to, is you don't sit on the toilet. Just bend a little bit and try and maneuver and pass urine. Don't, so that your body doesn't touch the seat. Because it is being used by so many people, you don't know what kind of hygiene is maintained by other people. So it is necessary always to be careful and use it with care, especially the Western toilets. Secondly, you have to rule out diabetes mellitus. So many times, the patients who have high blood sugar, they are prone to all sorts of infections. So urinary tract infection is also one of them. So if you have got a family history of diabetes, if you are a diabetic, then at the beginning, immediately as soon as you have symptom, you should rush to the doctor and start treatment and take a full treatment. There's one more thing which I wanted to bring to your notice, is that sometimes the vaginal infection is also confused with urinary infection. In vaginal infection, normally there is itching. Because of the itching, that part becomes raw, and when the urine touches it, it burns. So the patient feels that it is burning, means it's a urine infection. But normally it is not the urine infection, it is the vaginal infection which is causing that burning. So if you have got itching associated with those burning urine symptoms, then you should always go to a gynecologist and rule out whether you have vaginitis. Because mostly at that time it is not the urine infection, but it is the vaginal infection which is causing the problem. So you have to be careful, maintain hygiene, change your undergarments twice a day, use public toilets with care, and rule out diabetes. So if at all you have got stone, then that also should be ruled out, because sometimes the renal stone, kidney stone or ureteric stone can also cause urinary tract infection. And lastly, I would suggest that please take the treatment, full treatment which the doctor has prescribed to you, because if you take half treatment, half-hearted treatment, then the urine infection can recur and you may land up in a chronic urinary tract infection. So be careful, and if at all you have any doubt, you're free to call me and ask, please. Thank you.